So cases of COVID-19 are on the rise in 34 states, mainly in the South. In 12 of those states, the increase is as high as 50%. So meanwhile, scenes like this lake party, here it is, wow, in Michigan that we showed earlier, are happening all over the country. As you can see, there is no social distancing and no masks in sight. Wow. Dr. Kohli joins us live as DBL's medical expert. So Dr. Kohli, first of all, welcome. Thank you for joining us. What is going on here? Why is there a huge divide among people on whether to follow guidelines like wearing a mask? I'm so confused by this.
Hi, Sam. Hi, Al.
Hey.
So I have to say, you guys, I've spent a lot of time thinking about this, and I really don't think that people are bad people. I think there's some legitimate reasons for why people are just not getting the rules. So I've come up with my top 3 reasons for why that might be. The first and most important reason, I think, is that people are just confused, to be honest. There's a lot of mixed messaging, and there's a lot of misinformation from the leadership. And that has been the problem with this pandemic from the beginning. We've had misinformation about treatments. We've had misinformation about how well controlled the pandemic is, misinformation about tests going up, about cases going up because the tests are going up, mixed messages about wearing masks from the president, and mixed messages with the health experts saying that you stay away from public gatherings and the president hosting another rally this weekend. So I really think that that's one of the biggest drivers of this type of behavior, is that people just don't understand and don't know who to believe. So it's easiest to believe the truth that they know. The second reason, I think, is because denial is a really powerful coping mechanism. Now, we've all denied something in our life at some point and coped that way. And even the leadership actually denied the pandemic in the beginning, and that's part of why it got out of control. And during times of crisis, denial usually serves us really well. So in World War II is when they coined the phrase, keep calm and carry on, because it helped people get through the crisis of the war. But unfortunately, in this case, denial is actually counterproductive. So by pretending like we can party in the face of the virus and not let it win over our lives, we're actually enabling it to win. And then the third reason, I think, is people have lost so much control over their lives because of the uncertainty, that one of the ways we regain the control is by being rebellious or, doing something that allows us to exercise control over the small things in life so that we feel like we're in control from a larger perspective. So I think there's some psychological reasons for this behavior that we're seeing.
All right, Doc, I'm going to follow up with you. Obviously, we had the tragic event. Nick Cordero lost his life. He was 41 years old, active Broadway star, no pre-existing conditions, but he still suffered severe complications and just passed away after months of hospitals. So we've heard that this is deadly for seniors. So why is it deadly for a young, healthy person like Nick?
Al, that's an important question, and I think even though Nick's loss is so tragic, it really does illustrate to us that the young people and their immune response can really wreak havoc. So Nick became sick with the virus in March of this year, was in the ICU for over 90 days, and even after he tested negative for the virus, meaning the virus has already kind of left his body, the damage that it left to his organs, he had kidney failure, he was on dialysis, he was on a ventilator, he was on a heart-lung machine, he needed a pacemaker, he needed his leg amputated. It was just, he couldn't bounce back from the damage that it created. So there's 2 important lessons to take home from Nick's unfortunate death. The first is that the young people really need to heed this as a warning, because we don't know which young people are going to end up like Nick. And then the second is that there's actually a big lag between the cases and the deaths. So remember, I told you Nick got infected in March and he died in July. So even though we're seeing the cases go up right now, we're actually going to see the repercussions of this with the deaths piling up several weeks or even possibly months later. So we have to keep that in mind, that just because we don't see people dying right now doesn't mean that it isn't coming later. We're going to have consequences from these cases.
Wow, you heard it from Dr. Kohli herself, everybody. Thank you, doctor. You'll be back tomorrow. So if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. Again, no panic, just prevention and precautions.